Good evening, everyone. I'm Megan Cullup, along here with Scott Micklin.
Good morning. It's Tuesday, May 5th.
Good morning. Did I say good evening? I think
You
I
did.
did.
I think you did. It's evening somewhere.
It's evening somewhere.
So we'll go with that.
I think in Australia, right? Because they're like a whole 24 hours.
That's
ahead of
right.
us. So there you go.
There you
For
go.
all of our Australian listeners.
We may have some. We have a listener in
In
Hawaii,
Hawaii.
so, you know. It's
Taken off.
That's right. The show is really moving. So
Time is fluid.
It's
anyway.
good to have time is fluid. It really is. It's good to have everyone with us. We have a big show today. Joining us in a few moments is Dr. David Scrace from the New Mexico Department of Human Services. He's a cabinet secretary. You may have seen him on some of the press conferences that the governor has done, and talking a little bit about how the state is dealing with COVID-19. So we're pleased that he spent some time talking with us today, and so we're looking forward to that. And of course, we've got numbers.
We've got numbers
That we can talk a little bit about, too.
Yeah, talk about some numbers.
Let me call those up right now. But as of yesterday, 118 new cases across New Mexico. We're at 3,850.
Okay.
In San Juan County, we had 26 new cases yesterday. That took us to 736. There were 12 deaths in the state, and 6 of those were here in San Juan County. So there we go. That's the latest numbers. And again, you know, they are what they are. We don't.
Right.
I mean, we try to interpret them to a certain degree, but I know there's a lot of folks like Dr. Scrace who's really looking at these numbers as we talk about, you know, where things are headed, as we try to flatten the curve, especially here in Northwest New Mexico, which is part of the issue. So I just want to make sure I've refreshed this page that we're showing the latest numbers.
Right.
Hold on.
Those look different to me, but then they start all blurring together.
Right.
Truly.
Well, it's true.
Yeah.
So let's see what we can do here real quickly.
I mean,
Sorry.
the through line as they keep expanding. So, well, I mean, I feel like this is the perfect time to lighten the mood a bit.
Okay.
Okay, so
right.
I'm following. Yeah.
All right.
So there's a lot of baseball fans in this town, as we know.
There are.
As we know.
I know.
And one of the big tragedies right now is the cancellation of Connie Mack World Series this year.
Right.
But I would like to say baseball is back somewhere.
Is it now?
It's back in Korea. So,
all right.
If you're able to stay up till 1 a.m., that's when you can catch the games.
Australia, we're talking to you.
Australia, another shout out to you this morning.
That's right.
Well, there's a lot of great baseball players.
So how are they doing this in Korea? Then? Is it just an empty stadium?
No, Korea's just doing better. They were able to clamp down really early on their cases.
I see.
So now, I mean, I think there's still that fear of the second wave and stuff over there, but they really are faring well right now. So they're just opening it back up entirely, and there's a lot of baseball players that come from Korea to play in America that are some of the best.
That's true.
Yeah, I have a very nascent love of baseball that started last year.
Okay.
So,
not to be Captain Obvious, but we're talking South Korea.
Yes. Oh.
Okay.
You haven't heard about the North Korean baseball team?
I really have not. I don't know why.
They're called the Rockets.
Okay. Right. Interesting. Okay. So South Korean baseball, they're back.
They're back.
Okay.
Just to throw out.
So if you need a baseball fix, I imagine
a lot of people in this town do. It's spring. That's one of the great things about spring.
I know.
Right? Open up
all
the
spring
windows,
training was messed up this
baseball.
year, so people are very, needing baseball.
Yeah,
that's for sure.
We are. The people are needing
they
baseball.
Do. That's true.
So,
okay.
There you go.
Thanks for sharing.
Yeah.
That's cool.
You're welcome.
Very good. Okay. Well, let's get to our interview, shall we?
Yes.
I think we should. Again, we appreciate Dr. David Scrace joining us. Again, we talked to him yesterday, but very pertinent and timely information. So let me get that loaded up here so we can listen to what he has to say. Joining us now to talk a little bit about the figures here in northwestern New Mexico from Santa Fe, Dr. David Scrace is with us this morning. Dr. Scrace is the Secretary for the state's Human Services Department. And good morning. Thank you for joining us.
It's good to be here. Thanks for having me.
Thank you very much. And let's get started, Dr. Scrace, by asking you a bit about, of course, the numbers here in northwest New Mexico. They've certainly not where the governor or probably you would like them to be. And so what's your advice going out to the residents in northwest New Mexico, in Cibola, McKinley, and San Juan counties, and to the medical professionals? What's your advice to us today?
Well, you know, the numbers actually are quite high. in the northwest region of the state, and they've actually been about 3/4 of the total cases for the past couple weeks now. We've actually seen a peak with a gradual decline in the rest of the state, but when you add San Juan, McKinley, and Cibola counties, which is the northwest public health region of the state, the numbers continue to go up. And I was looking at the numbers this weekend, and while they vary a little bit and go up and down a little bit, there's still a very strong upward trend in northwestern New Mexico. That is of concern not just to me and the governor, but I presume to everyone who lives in the northwestern part of the state, because it means that we have what we call unmitigated spread, that the disease is still spreading, it's spreading rapidly, it's affecting a lot more people, and that in order to get this under control, we're going to have to do a lot more in the way of keeping people physically distant from each other than has been done up to this point. So we follow those graphs. I think you're aware that last week we announced a gradual reopening of other parts of the state because of the fact that it seems like the spread of the virus is going down everywhere else. But in northwest New Mexico, we did not reopen businesses, did not reopen, medically necessary surgeries beyond what they're being done now, did not reopen physician and other practitioner office practices because there's simply so much risk of spread in the Northwest right now.
Great. So I have a question that's kind of twofold here, but it relates to what you've been speaking of. And one of those questions is, we hear a lot of commentary, a lot of rhetoric, and it used to be very clear that this was a flattening of the curve, and I think it's very clear that we haven't peaked or started to flatten. But then you hear some other talk about, or it seems like maybe now we're trying to ride it out as long as possible. So sometimes it sounds like the goalpost might have moved a bit, but is it still our intention to open up as soon as that curve is flattened, or are we trying to ride it out a bit longer?
I don't know what you mean by ride it out as long as possible. Could you clarify that? I mean, if you're asking, are we trying to do everything we possibly can to avoid excess deaths in New Mexico, then the answer to that, of course, is yes. But what do you mean ride it out as long as we can? And what do you mean about the goalposts moving? I'm not understanding. Sure.
So the flatten the curve piece was as soon as we see that decline and it flatten out, we can open up. But the other thing I was referencing was, or is it the case that now we hear some more rhetoric about let's see how long we can go until we get a clear treatment. Let's see how long we can go until we get this vaccine. That's what I mean. Is there any suspicion that we'd actually push it further even after we see the curve flattening?
Well, I haven't heard either of those two statements in any of my conversations in the past 8 weeks. So governor's not saying that. I'm not saying it. Secretary Kunkel is not saying that. So I can't speak to your sources, but that's not how we're looking at it. I can't share my screen with you, and I know it's a radio show, so you don't have a screen to share with viewers, but I'm looking at a slide from the press conference that Jody could send you. It's a daily 7-day average case count by collection date, and what you see is a green line of all of New Mexico except for the Northwest going up and then coming back down, and as that's coming back down, now we're moving to reopen. The other line is a red line from Northwest New Mexico that just keeps going up and up and up, and so it's sort of a moot point about whether or not we plan to reopen in the Northwest when the curve comes down. I think there's evidence that we've done that in the rest of the state, and I don't see any reason why we wouldn't do that in Northwest New Mexico when we see cases starting to decline.
And Dr. Scrace, let me pick up on that, if you wouldn't mind, about that line then. And is that something that you're watching for, that line obviously to start coming down? And would there need to be then a certain period of time that we're not seeing any more spikes or anything like that, the line just staying flat or declining in order to then spark some of these conversations about possibly reopening the parts of Northwest New Mexico?
Yeah, I've read a couple dozen state plans and, of course, the federal plan, and they have what's called gating criteria. They all do. And the gating criteria in almost every single plan there are four. And the first one is number of cases or spread of the disease. And in most states, they're looking at a 2-week decline in cases. And actually, the math on that, we were very, very close to moving toward a reopening in the rest of New Mexico after a little over 2 weeks of decline. But we were also measuring the whole state as a whole, which was not declining as much, mainly because of the activity in the Northwest. Second category is testing, and we're doing a great job in New Mexico expanding our testing. And so we want to make sure we can keep up that testing. And I'll explain why in a minute. The third category is contact tracing. And the way this works is if we do enough tests, we identify people who are positive, then we can, one, call them and have them isolate for 14 days. And second, we can have them give us a list of every single person they've had contact with from about 3 or 4 days prior to their illness starting to the present. Then we contact all of those people and isolate them and hopefully test them so we can prevent further spread. So that's what all of that measuring really is about. And then the fourth category is hospital system capacity. Can the healthcare system in New Mexico support us opening things up more, knowing that automatically when we open things up, we will see an increase in cases, hospital and hospitalizations.
Understood. And I guess that makes sense then of why you're looking so hard at these numbers in Northwest New Mexico, because of course we don't want to overwhelm our local hospitals, and so far they tell us that they are doing okay, and they have room for additional patients and things like that. I assume that's jiving with what you're hearing too at the state level, correct? That our local hospitals are managing this influx of patients?
Well, I can tell you that we've transferred 91 patients in the past 8 days from northwestern New Mexico to Albuquerque. So I guess it depends on what you mean by managing. If you mean by taking good care of the people that they have capacity for, I have absolutely no doubt that that's the case. But if you mean ability to take care of effectively all the sick people that come in to Gallup and facilities between Gallup and Farmington, then the answer would be no, because we transferred 91 people. That was since the call center came up for these transfers. A couple days before that, we had transferred over 40. So we're in the 130s now of people who've been moved from northwestern New Mexico down to Albuquerque, many, if not most, for critical care.
I see. And I guess that's designed to work that way, right? So that you're not overwhelming these local facilities, and they can be moved, the stable patients, I suppose, can be moved to Albuquerque to leave room at the local level. Let me ask you a bit about coordination with the Navajo Nation, because again, we know that many of these counties that are problem counties that have high numbers border with the Navajo Nation. The Navajo tribe, I think, has tried their weekend curfews and some of their things to try to stop the spread. Is the state able to coordinate with the Navajo tribe, again, as kind of a coordinated effort to try to help conditions here in the northwest corner?
Yeah, I believe that's going well. There's a number of different ways that happens. The Department of Health connects directly with Indian Health Services. Testing efforts are more coordinated now, and in fact, Department of Health is going to be up providing free testing in Shiprock today to enhance the number of tests on there. Again, for the reasons I said earlier, the governor has launched a task force to really work with the Navajo Nation on containing the spread there. I think her order to close Gallup using the Riot Control Act was done in concert and in full agreement with the mayor of Gallup and President Nez of the Navajo Nation. So we all understand that this is a big issue, and we also understand that this is a problem that is being handled by 3 states, because Arizona and Utah are also home to portions of the Navajo Nation. And so different states have different approaches, and we are trying to work more directly now with the CDC to see if we can get a common approach through the CDC to testing, contact tracing, isolation, quarantine, and the like.
Dr. Scares, can you speak to the spread that we're seeing in nursing homes and assisted living facilities?
Sure. Everybody says and pronounces my name incorrectly. It's Scrace, rhymes with grace. So, but you can call me David if that works better. I'm fine with that. In Europe, over half the deaths from COVID-19 were people in nursing homes. It's a very vulnerable, very frail population. I happen to be a geriatrician. It's my practice, so I exclusively take care of old people, people over the age of 75 and up, and I have patients over 100 years old as well. We know a lot about the changes that occur with aging. The immune system does decline in its function, and so number one, it makes folks who are in facilities more vulnerable because of their age. In particular, in addition, in congregate settings is a separate risk factor. Anybody who's living in close quarters has a much higher risk for the spread of COVID. And so the combination of advanced age and then the congregate living situation, and then the fact that most folks have additional medical conditions, be it diabetes, high blood pressure, heart disease, or the like, it's a very, very vulnerable population. And we now have multiple nursing homes with multiple cases. We've created a COVID-only nursing home in Albuquerque in order to discharge patients from hospitals there so as not to introduce new COVID cases into other nursing homes. The DOH also has a very aggressive testing program now that is going in immediately if there's a concern about a case, and if there's a positive case, testing every nursing home resident and every staff member as well in order to, again, identify positive cases, isolate them, reduce further spread.
Understood.
And of course, as you know, there is an outbreak in Farmington as well, nursing home there, that is where a fairly high percent of folks are infected.
Right, and that concerns, of course, all of us, and I know a lot of family members as well here, Dr. Scrace, who are concerned about the spread in those types of facilities. Let me ask you, maybe we have time for one final question this morning about the numbers of tests. We're seeing more testing events. We know there are testing events going on in the Shiprock area and the Crown Point area, and so that's going to probably bring more positives to the numbers that we're seeing in these counties in northwest New Mexico. As the CEO of the hospital here was telling us just yesterday, it's important to note the percentages of positives out of the total number of tests that are being given, and that's an important number to pay attention to?
Yeah, I think that what we saw in Europe, in China, in the United States, we never saw it in New Mexico, by the way, which I'm very proud of, but you would see some states with 80% of their tests being positive, or 50 or 20 even. We started out at 1%. We varied between 2 and 5%. Now, as the epidemic has spread more, I don't have the numbers off the top of my head for Northwest New Mexico right at the moment, although I think you could probably calculate those on our website, because you can now click on a county and see the number of tests and see the number of positive tests. So, but in a place where there's a more significant outbreak, like we're seeing in the Northwest, then the testing percentage tends to go up. You keep testing, you identify more and more people. Remember, identifying more and more people who are positive is a good thing, because if you don't test, those people, many of whom have no symptoms whatsoever, just go about their daily life, contacting other people, perhaps spreading the virus further. So increases in testing always help contain epidemics, and these efforts up in the Northwest that the Department of Health is doing today, any outreach and testing. I know Gallup Indian Medical Center was the first one to set up drive-through testing for COVID. All of these efforts help, and so any additional testing really does help us identify sick people who may not know they're sick, who may have no symptoms, allow them to be isolated and no longer spread the disease.
Good to know. Well, Dr. Scrace, again, we appreciate your time and your insights and your calm demeanor. I must say, I appreciate that too as we go through all this together. And we certainly appreciate you sharing some of your expertise with our listeners and viewers today. Thank you very much.
You're welcome. I guess the one last thing, two last things I'll say. Number one,
of course,
one learns a calm demeanor in one's medical training. You basically, as an internal medicine resident, I ran the cardiac arrest team for a long period of time. And one thing you learn right away is being calm is the only way to be effective. Second thing for all your listeners, and I tell this to everybody in the state, not just people in the Northwest, but still stay at home. Avoid contact with other people. Avoid going out. If you have a risk factor like being older or diabetes or live in a congregate setting, be extremely careful. Wash your hands as often as practical and take good care of yourself. So we're in this together. We can get through this together, but we all have to remember the fundamental way that this virus spreads, and that's through contact with others, and we just have to continue to avoid that wherever possible. Wear a face covering if you go out in public. I was out, unfortunately, I had to go out to get a part for my swamp cooler, and I was sort of stunned by the fact that there were maybe 3 or 4 other people in a fairly large place wearing face coverings. I was one of them, and that's something we're going to have to do better if we ever hope to get back to some sort of normal life in a COVID positive world. So thanks to you for your time as well.
Thank you. Well, we hope we can do this again, maybe at some point in the future, Dr. Scrace, when there's some better news to report from our corner of the state. But thank you for the job that you are doing along with the governor and the health department secretary there in Albuquerque. Thank you very much.
You're welcome. Bye-bye.
Stay well. Dr. David Scrace, he is the secretary for the Human Services Department in the state of New Mexico, our guest here on KSJE. And there you go. A little bit of ventriloquism there. I was talking, but my mouth wasn't moving.
That's what I noticed. I was like, oh,
I'm so
weird.
sorry.
My shirt's different. How did I do that? Okay.
Different clothes. There you go. That was yesterday. We told you. That's true. Anyway, but we appreciate Dr. Scrace. Again, it's great to get some perspective from a statewide official. Mm-hmm. And again, a shout out that they do these press conferences every week. We've been invited to participate. Our format doesn't really relate very well to asking just one question during a press conference, so we appreciated his extra time to answer both of our questions about what's going on here in the northwest part of the state. And quite frankly, the Albuquerque media, for the job that they do, we're not their priority. They are asking questions about Albuquerque and Santa Fe, not the northwest corner in most cases. So anyways, we appreciate Dr. Scrace being available and look forward to when he comes back. Again, hopefully with some better news. So there you go.
Yes.
There you are. But we have a person on the phone, so we can go to the phones.
Callers.
Good morning. You're on KSJE. Who is on hold?
Good morning. This is Cathryn Abeyta.
Cathryn Abeyta from the San Juan United Way.
Yes.
Thank you for calling in. Great to hear your voice.
Yeah, absolutely. I'm calling in, I think, with a little bit of good news.
We love good news.
God.
We love good
Good.
news. So there you go.
So San Juan United Way has been working pretty hard in the background these past few months, and we have partnered with some amazing community supporters and even non-local supporters to establish a COVID-19 community relief fund that will be able to grant out to nonprofits working in San Juan County, kind of on those front lines, helping to serve people right now.
Terrific. And so this is, again, you've gotten these donations from other entities in the community, and that's been going into this fund, and now it's time to spend it.
Yes. Of course, we're always going to keep raising money because we know that the needs are high. But we have raised just over $50,000 to date. So it's time for us to start giving out some of that money and helping as many nonprofits in the community as we can during this time.
Great. And so if I was a nonprofit looking for that help, how would I apply?
So this is going to be the easiest application a nonprofit has ever filled out, I think, for funding, which we're pretty proud of because we're trying to take down as much of the red tape as possible right now, because right now it's all about just getting help to who needs it.
Quickly.
So go to our website. Yeah, go to our website, sanjuanunitedway.org, and on the very first page there's going to be 2 buttons. It's a donate here and an apply here. So there's going to be a little bit of information for the nonprofits looking to apply, and you click apply here and you can apply right online. It's about 6 questions, and really we just want to know what it is you're doing in the community, and how can we help.
Very good.
Very good. And
Excellent.
so is there, like, during this specific COVID-19 time, are there specific focus areas that you think would be the most beneficial to give some money to?
Yeah, I think any nonprofit right now that is providing a direct service that would be considered like a basic need, making sure that people have enough food, making sure people are able to stay in their homes, that they have heat, that they have water, that they have those essential items. Medication, that's another one. Those types of services, I think, are going to rise to the top priority, just because those are services that are giving people what they need today. But we also see that this is going, we see that this is going to have several phases, just because that's how this crisis is unfolding and evolving. So for this first phase, we really want to provide for basic needs. But as we keep going, the needs are going to evolve and change. And so we ask that people just apply on a rolling basis. We're not going to have a cutoff date for a while, but we may not be giving out funding every single week. So it'll just depend on the priorities, what agencies need, and how much money we have to give out.
Makes sense.
Right. And Cathryn, the amount of these are grants, I assume, would be just dependent on the application. I mean, are you asking folks to give a number when they're applying of how much money they could use, or how is that working?
That's a really good question, and this is a really unique approach for us. We actually don't even ask them how much they're asking for, because we're going to have a panel of community members and volunteers, community leaders that are going to help assess this, assess the applications, assess the needs, and award grants ranging from about $1,000 to $5,000. And these will be really quick turnaround grants. So if you apply during a time that we're giving out money, you can expect to receive your award within a week or so.
Understood. And so, again, this is open to nonprofits, to be clear.
Yes.
And then if a nonprofit applies and then they maybe 3 months from now they're short again, can they reapply, or is this kind of a one-shot deal, or what are you thinking?
Well, that's a really good question, too, and I think it's too early to call. So
I see. Right, because this is evolving, right? We just don't know how long this is going to be in place.
Right, and we don't know what, we don't know what's going to happen next month. We don't know what sort of need is going to arise in the community where maybe it just doesn't seem obvious right now, but then in a month there can be a fallout to something else that we haven't prepared for. So in the case of something like that, we would always be available to reevaluate and help nonprofits multiple times. So for right now, we're just going to do kind of one pass-through. But agencies can keep applying. If they received funding and a new need comes up, I say they can try to apply. At the end of the day, the decision is going to be made by a group of people in our community who have the community's best interest at heart. So, I just believe that for right now, less rules and more of our community, working together to decide how do we really help our community today and tomorrow.
Yeah, that's beautifully put. And so, again, if I was a community member and I would like to donate, I go to sanjuanunitedway.org, click on donate, and then if I was a nonprofit, I would click on apply. So, again,
easy breezy.
It's so easy breezy, although
Right.
the United Way is known for making things easy breezy, right?
We try
Yes.
because, and another really cool thing about this, which for me is obvious, but it's because I know United Way, I know what we're doing all the time, but some people still don't realize that 100% of the money that we raise goes to the nonprofits. It doesn't stay with us. It doesn't pay our heating bill or anything like that. So we don't take any fees or fundraising service fees or processing fees out of it. So it's a really special way to give back, even if you only have a few dollars and you just want your money to go to support the most urgent needs in our community. It's a really cool way to do it because we're going to be vetting all the nonprofits. We know what we know what services are most important, and we can make sure that it gets there, and we can direct a lot more funds in a coordinated way. So.
That's right. That's right. And it is true. I mean, I've seen firsthand how far the United Way can stretch a dollar. And I think it's also important to mention, since we got you on the phone, that if you still have stable employment, that you can still enroll in the payroll deduction plan, right?
Yes, absolutely. That is the typical way that we raise money all year. So we'll spend the fall going out and campaigning, and so we will talk to as many groups of employees around the county as we can, and they can choose to give a few dollars out of each paycheck. And that ends up sustaining our entire year's work the next year. So that is, I think that's what we're most worried about. That we're going to start seeing, later on in the year, how much employment has affected our charitable giving, because that money goes directly to 18 local nonprofits from us. But then in addition, we pay out to over 150 additional nonprofits. So there are a lot of nonprofits, which are small businesses, that rely on this type of support from the community, and we expect that to be just another way that we have to get creative in the near future.
That's a good point, Cathryn. And again, full disclosure for our listeners and viewers this morning, of course, Megan Cullop was the campaign chairman for the United Way this past year.
Yes.
Right?
Yes.
And, of course, I'm on the board of the San Juan United Way, so we both have connections to the organization and can certainly testify how well you do in getting aid and help and assistance to local nonprofits and your member agencies, but also folks in the community. We've talked every week, I think, about the Want to Help line, and that's a United Way project as well.
Right, you need help, you want to help, So the 211 number.
So kudos, again, for all the work that you and your staff are doing down there, Cathryn.
Oh, yeah.
I appreciate it. And I think Megan does, too.
Yeah,
Megan does. I do.
Thank you. We couldn't do any of this without you guys, and I'm so lucky to be calling in, and both of you have been involved in United Way. I want that to always be the thing, that anybody who's talking to me has to disclose that they've been a part of United Way, because I want everyone involved, because that's what makes it so cool.
That's true. And so
makes it united.
Right.
It
does. And so for this opportunity, you don't have to be a United Way member agency. This is open to any nonprofit really in the region who is providing assistance during this time, probably direct assistance to residents is kind of the one thing you mentioned, but that's kind of what you're looking at for funding, correct?
Yes. And if I could make a little shout out, one area that we're looking to help is what nonprofits are working on the reservation right now, that we can help them deliver more services and resources to people who are in disproportionate need.
Right. And we keep hearing the stories about the need out on the reservation, so I think that's a great thing to want to do, and that's important.
Yes.
So perfect. Well, Cathryn, thank you for calling in, and let us know how it goes, and keep us updated if you will. But I hope you run out of money soon, because that means we have the needs are being met.
We're helping.
Yes, absolutely.
Wonderful.
Thank you so much for letting me plug this, and thank you guys for keeping us all informed.
You are welcome. Call back anytime. It's Cathryn Abeyta from the San Juan United Way. And again, as a board member, I know the staff isn't huge down there, but they have been working. Yeah. They've been working really hard throughout all of this and putting together the Want to Help line and Need Help line and 211, in addition to the campaign that Cathryn was talking about, the regular old United Way campaign that, again, goes to support the other member agencies throughout the new year. So
Right. Yeah, and it really isn't. They have a very helpful breakdown that you can find on their website, but they sort of like met out. Like if you give $13, you can provide 2 backpacks full of food to school children and things like that. And so that's just to say that we hear a lot about if every dollar counts, whatever you can give. And I think in this organization especially, it's true. Like, whatever you can give and every dollar counts. And it really, as she said, 100% of it goes back to the nonprofits, back to the community. And so that's very important to point out.
And yeah, exactly. So it's important. And so thank you for sharing that. I think that's good.
Yeah.
And thanks, Cathryn, for calling in. So
Yeah.
that's great. Anything else going on today?
Sure.
Right?
Yes.
I think there is.
There is.
I'm going to put up the phone number in case anybody else wants to call in,
You should
because not
do
that one.
Oh, not the Cathryn. Okay.
No, I want that one.
We don't want the disease picture with Cathryn Abeyta on it.
I want that one.
Yeah, personal algorithm strikes again and sent me a story this morning from a behavioral economist, and the story was titled, "What do you do when other people are not social distancing?" So, yes, so if you go to the store and somebody's standing a little close, what are you supposed to do? Or if you're wearing a mask and you notice a lot of other people are not wearing a mask, right? So this is very, very relevant, because you and I have talked somewhat about this, like these Facebook wars. So we might see something that's inaccurate information or something that's like how to call somebody out on that, or should you call somebody out on that whole thing. And so basically it was a very gracious take from this economist, and it was a behavioral economist. And so if somebody's standing too close to you, that you clearly have a right to say, hey, it's a little close. Can you take a few steps back? I don't really know the wording you would use. Right. Because normally I just move in that situation. But maybe you're in close quarters.
Maybe like an excuse me.
Yeah.
Would you mind
backing
away 6 feet?
Excuse me. Back away.
Please.
Please.
That's always, I think that's always helpful.
That's
an excuse me and a please.
Right, or maybe it's like, oh, my definition of 6 feet looks different than yours, or something like that.
I guess.
That requires a lot of digging that.
Right.
Anyway, but what I thought was really pertinent and appropriate was the mask thing. And so basically what they were saying was, hey, nobody's trying to give you the virus, like, intentionally. Nobody's walking around thinking it would be great if I can just infect as many people as possible, right? That's not happening.
Right.
Probably. Hopefully.
Hopefully.
I would say, safe to say that's
98% are not trying to do that.
So there's 2% of people in your mind that are trying to do that? That's a high percent.
Okay. Anyway, please continue with your story.
Anyway.
I'm sorry to interrupt.
I'm just saying that's a high percent. Okay, anyway. But they were saying it would be better if you want to communicate that via social media, that just post yourself wearing a mask, which we've seen people do, their new profile pictures with them wearing a mask, etc., as opposed to publicly shaming people and taking a picture of like a crowd where a lot of people aren't wearing masks, for example. So I thought that was helpful. It's always nice to remember that in this trying time, being gracious is a better choice usually than a public shaming option. So,
I agree.
Yeah.
I think that's true.
There you go.
And in the words of Dr. Mike Hadaba, who talks with me on Wednesdays,
there you go.
He has a new policy about social media, and he's decided that someone's Facebook page, for example, is just like how they decide to decorate their house. That's what they put on their Facebook page. Mm-hmm. And if you disagree, that's great, but that's their choice.
Right.
So if they want to post far left wing or right wing or any wing type of stuff on their page, that's their right, I guess, and their free speech to do that, I suppose.
That you would never go into somebody's house and comment, probably, on like,
or rip down the curtains or something.
Like, weird wallpaper today. Like, you wouldn't do that kind of stuff. Right?
So that was his take, which I appreciate.
That's a really helpful image.
Yeah. I think I like that. Mm-hmm. So I've tried to stop calling out people if they're posting things that maybe aren't true on their Facebook page. That's their, I guess, decorative choice.
And so this behaviorist would say, just don't share it, right? So, don't promote it. And in fact, the more that you comment on it, the more the algorithm's going to produce it, and the more people are going to see it.
Right. Now, I may report it to Facebook as being fake.
You can report it,
and because
they have a thing for that now.
And I might snooze you so I don't see your post for 30 days because
I don't
they're
need
not
that
true
in my life. Right, exactly.
So that's my new mental health Facebook policy.
Yeah, I think that's a great strategy. So when in doubt, be kind, I think, is the ultimate
I believe that's true.
message.
There you go. And again, as Dr. Scrace said, we'll all get through this together, and it takes all of us to do these things, So
especially you, 2%.
That's right. All right. Maybe it was 99.9%.
I don't know. 9%. I'm speaking as though I'm like a statistician.
But I know I've seen
no clue.
unfortunate news stories of people that have not been as well behaved as one would like them to be.
There you go. Yeah.
There. So
that's well put.
Okay, there you are. But anyway, well, thank you everybody for joining us today. I think we're about at the end of our stuff that we wanted to share. But tomorrow we have a busy show on Wednesday.
That's right.
We're going to be talking to as you referred to him lovingly, the plasma
guy.
To talk about the donations of plasma, blood plasma.
So great.
Of patients who have recovered from COVID-19, and we'll explain the reasons why they're looking for those donations and what they hope to do with them.
That's right.
For science.
Yeah, for science.
So.
Well, it's really exciting because this is something that the East Coast was experimenting with. And so the fact that, Plasma Guy is helping usher this into our area of the world is an exciting thing.
Right.
Because it's a more cutting edge treatment. So hats off to those folks.
Very true. And so we're talking to him. We're going to talk to instructor here at Salmon College about ways to help on the Navajo Nation. She's very involved with that. And then we're also going to be getting some entertainment, I think.
Oh, my gosh.
Right?
Oh.
Local.
Local entertainment.
Let's not spoil it.
No. But just be ready because it's delightful.
Tomorrow.
Yeah.
Okay, looking forward to it. All right, there you go, everyone. Well, thank you for joining us, everybody. Again, this is KSJE's, the local COVID-19 information program. It is aired Monday through Thursday, live at 9 a.m. on the KSJE Facebook page and our YouTube channel. Rebroadcast at noon on our partner station, KNMI 88.9 FM, and at KSJE 90.9 FM every afternoon at 5:06 p.m. So, with that being said, stay well and stay safe. We will see you tomorrow.